thought about quitting medicine. I had a plan. I was like, man, I'm not doing this anymore. This is crazy. I went through all this schooling and training to be this stressful. This is not what's up. So this is probably one of the most difficult videos that I've ever made. This is my second year in practice, and going from being a trainee to being a full-fledged attending can be a rough transition for a lot of people. I mean, it's a time where you are essentially, you've been babied along this path in medical school, residency, fellowship, and there's someone there to essentially take the blame or to answer questions or to just lean on when you need that support. And I'm not saying that that's not there when you're attending, but it's a lot less. You hold full responsibility for the patient. Especially as a surgeon, this is essentially from the pre-op period before surgery to what happens during surgery and also what happens after surgery. So it's a rough transition. I found that to be very true. Going from being a very busy fellow at a really busy fellowship where I ended my fellowship on trauma surgery, I was probably working 80 to 100 hours per week, working until 9 or 10 o'clock, sometimes 2 o'clock in the morning, getting back up and going to work again at 6 a.m. or 7 a.m. in the morning. Very busy, to going out to practice where my practice was very slow. So that was a rough transition for me. And it was a rough time for me, just being so busy as a resident and fellow. All of a sudden, you look around, there's really nothing to do. So you're building your practice, and this is quite normal. It takes 3 to 5 years to build a practice. And some people go out into their first job as an attending and they get busy right away. There's no spine surgeon there, there's no neurosurgeon there, there's no dermatologist or emergency room physician, dermatologist. If there's no one there, or if you're in the area that doesn't have your specialty, well, you're probably gonna get busy really quickly. Most other people, it takes time, 3 to 5 years, and you have to be very patient. It's very frustrating to, going from this busy lifestyle as a attendee or a fellow or resident, and you go out and practice and it's pretty slow. So I found that to be one of the most challenging things when transitioning from a trainee to an attending. There's the responsibility that if you operate on a patient, that's your patient forever. You have to own up to the responsibility, you have to own up to the complications that may arise. And as a surgeon, you're going to have complications. Any surgeon that tells you, hey, I don't have any complications, is a lie. You're going to have them, you just know how to deal with those complications. And those complications can be very challenging to deal with as a new surgeon, because you're trying to make a name for yourself in your community, you're trying to impress patients and do good surgery and help patients, but when you have a complication, it hurts. I mean, it sucks. The first few complications I had, I took it really personal, and I would stay up at nighttime just thinking about it. I'm like, man, I just can't believe that happened, or why didn't I do this, or what am I going to do next time to prevent that? So, these complications can really suck, but they happen. Just be honest with your patients and just see what you can take away from it and learn from it. Depression, suicide, burnout in medicine, it's real. I've never experienced that until about 6 months ago when trying to build my practice, frustrated from not being busy, and it led to a period of depression. I've never been depressed in my life. I've never experienced that before. I didn't know what to experience, what it felt like, what does it mean. I've never felt that before. And this video is not to discourage anyone from going into the field of medicine, but I just want the students out there to let you know that you're not alone. It's not normal, but it happens, and you have to, it's okay that it happens, because medicine is a very challenging career field. It's stressful. There's a lot of responsibility. There's litigation that can occur. So there's a lot of weight that is pushed on our shoulders. And I just want students to know that students that you're going through medical school, residency, fellowship, and you're depressed, or if you're burnt out, if you have those suicidal thoughts, I mean, these things do happen. People just don't talk about them. And I just wanted to use my platform to just bring awareness to those particular issues that people face on a daily basis. There's a study that came out that showed that 1 in 5 physicians are leaving medicine at this point because of the burnouts and because of the stress, depression. But my personal story, you know, it came on gradually, where frustrated for not being busy, few complications kind of early on, and it just hit me. All of a sudden, I didn't want to do anything in terms of extracurriculars, didn't even want to go to work, thought about quitting medicine. I had a plan. I was like, man, I'm not doing this anymore. This is crazy. I went through all this schooling and training to be this stressful. This is not what's up. And I had a plan to leave medicine, and I had those thoughts in my head, like, what else would I do? I spent all these years in training. What else would I do? And I would drive going to my office, to my clinic, and just dread those seconds, those last few minutes that I would have just driving up to my office, just because I knew that I was walking into something that I really didn't enjoy. But really, I was really depressed. And it wasn't until a few months later that I realized that I was actually experiencing burnout. I was taking call, trying to get busy, and I actually took 3 weeks, 21 days straight of trauma call. And I experienced burnout. This led to some depression. This led to a lot of other thoughts that I've never felt before or thought about before. But it made me realize that this path, if you don't take care of yourself in this path, you can't take care of anybody else. Symptoms of depression, loneliness, tired all the time, fatigue. If you feel like you have no interest in doing what you used to love doing, those things are symptoms of depression. Recognize it, get help, talk to someone about it. And that's exactly what I did. And, you know, looking back, that was a really dark place in my life. I've never in my life felt that way. Never in my life experienced kind of burnout, but it's essentially, it's real. So my advice for students out there, residents, fellows, just recognize that these things, they happen. At some point in your career, it's likely that you will experience what I went through. That was a very dark and lonely place for me. And I just don't want you guys to go through what I did, which it may happen, but talk to someone. Make sure you have an outlet to medicine, whether that is working out, traveling, spending time with your loved ones, some hobby. You need some outlet to medicine. You can't be all about medicine 24/7. That's what I did when I was taking 3 weeks of call, working late hours for 3 weeks straight, and so essentially it burnt me out. So this video, like I said, is not to discourage anyone from going into the field of medicine. This is just to bring some awareness, use my platform to talk about these issues that no one is talking about. Depression, suicide, burnout. People are leaving medicine, they're quitting their jobs because it's very stressful. It has a lot of responsibility. All the things that you have to deal with, the politics, bureaucracy, those things in medicine, they can definitely take a toll on you. So If you've experienced some of these things, make sure you talk to someone about it. Put it in the comments below. Let me know, how have you dealt with it? What are some things that you are doing to deal with this lifestyle, the stress, the depression? And it's in a lot of other fields, but in medicine, being a physician, this is one of the fields that has the highest suicide rate and burnout rate and depression. And it shouldn't. So, wanted to use my platform to just spread some awareness. But if you've experienced any of these symptoms, or if you experience depression, suicide, or suicidal thoughts, or any of those things, put it in the comments below. How have you dealt with it, so that others, we could use ourselves as a community to come together and move along together. So thank you guys for watching this video. I hope this video actually helps someone. I'm human, just like everyone else. And just wanted to share my story and kind of what I've been through over the last few months. Thanks for watching, and we'll see you next time.